Welcome to the Scientific Publications channel. I am very pleased to announce that today we are launching, I hope, our new regular segment, interviews with contemporary scholars and practitioners. Considering that topics such as scientometrics, article writing, science and practice, and scientific research are so rarely covered in the Ukrainian media space, it is a great honor for us to start this on our channel. And it is an even greater honor that we are launching this segment, in fact, with an outstanding figure of Ukraine. Today, and not only in Ukraine directly, Rostyslav Valikhnovskyi, it is a great honor for us that you have joined us.
Wait, did you really actually do that? An introduction like that means I still have to live up to such credentials.
This isn't even the introduction yet, because I wrote down all your achievements, since I was sure there were so many that I would forget them. I want to say, it's an honor. So, just in case someone doesn't recognize this face, without exaggeration, let me mention a few key points from the past. I insist I will voice them. Although I'm sure more people know you on the other side of the screen than know me, but I'll introduce.
I want to thank everyone who watches us and supports scientific publications and your wonderful team. Today is going to be very interesting. I think we can move on to the things that will be useful for our viewers.
Thank you very much. We'll display all the credentials on the screen.
Yes, that's better then.
It's better on the screen, yes, because a modest person is talking about.
We can skip credentials.
No, really,
That's true, indeed. Yes, that's the honest truth.
Great then. So as not to waste your time, let's get straight to the topic of our conversation. Today we'll be discussing many questions with you, including questions about scientific and surgical practice, and questions about specifically writing articles about the use of artificial intelligence in education, science, and its application in practice. And we'll try to cover all these topics for you today. The first segment will be about medicine and science. And in fact, our first question is that you are known on both sides of this field, aren't you? And in fact, what was the impetus for you to combine the practice of a surgeon with that of a scientist?
First, I'd like to start by thanking you for inviting me to this meeting. I'm impressed by your channel and have watched all the videos on your YouTube channel. I see that scientific publications have truly brought together talented young people and those individuals who are, in fact, responsible for their actions. Regarding your question, I'll say this. I was very impressed. It's your methodology itself, how you develop the strategy for working between theory and practice. I am one of those who came from practice because I have been in surgery for 27 years. That's a huge number of operations, more than 500,000 patients. Our team has treated them. We were involved in what I consider to be innovative topics in surgery and accomplished excellent research even in the era before artificial intelligence existed. It was a completely different era. Everything was much more difficult back then. Everything took place in libraries searching for literature. A review of the literature, one would take 2, 3, even 4 months, or even a year if you approached it thoroughly. Because every article had to be noted, every author recorded, each article read, analyzed, and selected. There really was some scientific novelty. What can we honestly add to? There is also the current state of science in this or that field of surgery. I work in reconstructive surgery. It's an ambitious field, very important for people. A specialty that, by God's grace, serves to treat defects, both congenital and acquired. And in fact, there is nothing accidental in life. A wise person once said that those who believe in coincidences do not believe in God. There is nothing accidental in our lives. And I realized that when I was still a high school student, I really liked one particular TV series. I often mention it in interviews, Return of Eden, where the main character of the series ends up in the jaws of crocodiles. Her beauty is ruined by the teeth of those crocodiles. She loses her attractiveness. And the storyline is that she was a very beautiful woman, but her marriage was unsuccessful. Her husband saw that she was the owner of a huge estate and decided to take her money in this way. After she gets caught up in this terrible story, she is saved. A local native helps her and sends her to his friend, a plastic surgeon in Canberra, Australia. He turns her into an indescribable beauty. The script of this film is very interesting. If someone finds this interesting, I invite you to watch it. That's a separate topic for discussion. We're starting with such a lyrical introduction, you see? And then I saw that there is a tremendous number of monographs and textbooks on reconstructive surgery. And basically, from the very first year of medical school, I knew that I would become a plastic reconstructive surgeon, specifically reconstruction, because it's a specialty that truly allows you to impact the quality of a patient's life. To eliminate problems related to appearance, people with congenital or acquired defects, when they enter society, often become outcasts from that society. They become targets for what is usually hidden hate, or in modern terms, bullying. And these are truly people with disabilities, not just physically, not only aesthetically, but also suffering from severe psychological trauma. Now,
As a person who did not bear the right to commission, it is resolved as quietly as possible.
yes, that's also a separate topic for discussion, and there is an entire field related to rhinology with tremendous achievements. Right now, in this specialty, by the way, we will cover this topic in terms of how artificial intelligence is helping rhinoplasty surgeons. These are the surgeons who work on both the internal and external structure of the nose. Let me finish my thought. Well, actually, this transformation that took place when we entered that field of surgery, which at the time didn't even have such opportunities in terms of the educational process, because the old way of surgery was about following, observing, assisting, peeking over someone's shoulder, watching your senior teacher. You would talk to them, attend dozens of courses, and at some point you'd feel that you already had, de facto, that surgery at your fingertips. Literally, if you protect it. Now we live in the era of YouTube, in the era of artificial intelligence, which will select for us on YouTube exactly which videos we need to watch on a given topic. We have video encyclopedias, video courses. By the way, my team and I managed to create such a wonderful course during the war, where we have 140 surgeons with over 10 years of experience. They studied both online and offline in a ratio of about 80-20 and received their diplomas. We have a certified course for credits. Those are the points. It is a postgraduate education course registered officially with the Ministry of Health under a specific number and code. And we issued, I believe, 70 or 80 diplomas, which were actually relevant for those people who needed them. The Ministry of Health now requires these points from certain individuals. Diploma, education. This is very interesting. So this transition from the period when you used to go and, to put it mildly, peek in, to this period when you can watch a huge number of videos in a single day, even processed in a numerical format, is a completely different quality of surgery.
100%. So actually, let's now segue a bit towards the topic of artificial intelligence, and we'll talk about scientific articles a bit later. Actually, this is very... How would you say these new technologies, especially artificial intelligence, are affecting your practice? As I understand it, these are changes. They have happened. And in craniofacial surgery, as you say, the changes are incredible. Perhaps for some of our colleagues it's worth emphasizing, because maybe some people still don't believe that this is the present and that we are already living in it. It's real.
The thing is, when we start learning, any educational process has its own logic, sequence, and roadmap. And when, given the current pace of artificial intelligence development, we set a task for AI to teach us as quickly and efficiently as possible, for this or that task, we will see that every application that uses its artificial intelligence to provide a certain answer, they are all different. And you can't lump all types of those applications or software or web pages that actually provide such a result. Of course, there are leaders, there are top leaders, which you talk about in your videos. That's Gemini, yes, the program from Google, right? Other applications that allow to approach advice as a scientific and practical activity. A modern wildcard abroad does not reveal themselves by their index. Worse, they do not reveal themselves by the number of articles in Scopus, in Web of Science, and do not show their development because they simply will not meet certain requirements for this or that residency or scientific fellowship program in this or that country. There is also another side of the coin related to this. After COVID and after the number of doctor deaths that occurred while providing care to COVID patients and the risks that medical professionals face during their work, it became clear that there is vaccination, there are means of protection, there are methods of prevention, but no one has canceled the impact of indicators like viral hepatitis and AIDS. those infections that pose a threat to modern surgeons despite all the protective measures, the presence of special goggles or special latex gloves, protocols on how to protect oneself from injury or self-injury while working with sharp or cutting instruments. But obviously for those super modernized societies, another filter for selection has appeared. Among the best, I'll say it directly, you really have to push yourself to get through residency in the USA to pass the USMLE Step 1, Step 2, and Step 3. At one time, I took these tests myself. Step 1, Step 2, the English proficiency test, TOEFL for medical practitioners. And that's a huge amount of knowledge you need to have to master and so on. Then the battle begins. Let's call it in English a noun, a struggle essentially, right? The barrier you have to overcome, let's say in the field of medicine, is in fact the practical residency, when you face night shifts, every other day, the third day, constant shifts, and for those 3 days you work in the hospital. So the reason I'm telling you all this is obviously that this forms the foundation for being able to go through such a difficult path. These methods related to artificial intelligence in the format of easier knowledge acquisition allow you to go through this path more efficiently, better, without mistakes, or with a minimal number of mistakes, and thus master a particular profession. Well, I think we can also bring up which scientific articles describe this. Well, it's 2.5 times faster than it used to be in the pre-AI era.
Are you really saying this applies to all professions?
To all of them, not just medical, of course.
Of course. And regarding medical practice, do you perhaps remember when you first realized, like, aha, this is a cool thing, artificial intelligence, that we are going to work with this?
Well, I'll put it this way. You know, it was really just like a sudden lightning bolt. The news just flashed instantly through the entire information space and the whole news space as well. The news broke that a robotic surgeon built on artificial intelligence, I emphasize, not just a robot or an assisting device like the Da Vinci system or other competitors on the market with their various hardware complexes, but an actual surgeon, a robot, literally performed a cholecystectomy operation.
And this is for our viewers.
This is the removal of the gallbladder. Now I see that there is more and more news like this. So what are we talking about? That into the robot, into the robotic system, into the software part, such a large number of surgery videos was uploaded that it exceeds the capacity of the average surgeon's brain to master such a number of operations, even from the perspective of a static approach or a dynamic static one, to review this amount of terabytes of these videos within a reasonable period of time. Roughly speaking, it's impossible for a surgeon because they simply don't have enough time to watch such a large number of videos. Then there's also the time needed for practical work. But here, in just fractions of a second, well, I won't specify the exact number of seconds because that's an interesting question too. Tens of thousands of these surgeries were uploaded, including both scheduled ones, those without problems and those without complications. And actually, the core sublayer of this system, how advanced was it already? It was so well trained that it was shown this robot performed one surgery, then another, a third, a fifth, a seventh, a 10th, all without any complications. Not a single one. To verify this, the same surgeries were repeated. Of course, the team was standing by. We will get that news from the media, from the internet. We will get it.
It was all happening right here.
By search. Yes, please. Here, frankly, not only was I scared, but probably many others were too, especially among the surgeons, because it's clear that in 10, 20, or 30 years, no one knows exactly how many years, a large portion of surgical operations will be performed by robotic systems based on AI. So friends, that's the news.
In fact, this brings us a bit to the question, does this mean the world will need fewer surgeons?
It is also encroaching on all areas of practical knowledge from time to time. If you look at the legal market right now, you'll see that lawyers are already drinking soft drinks to calm themselves down. or using similar means, figuratively speaking, of course, because there are already many fields and areas that have been taken over, for example, from this profession and from others as well. We are now standing in what could be called, well, an ideal storm, although the term is a bit different in its usual application. But the events happening in the world, the COVID period, this terrible war currently in Ukraine, and the things happening on Earth and globally, all of these clearly require by God's providence that humanity, that people find such answers, such practical solutions that will allow us to survive in these far from simple circumstances. Everything is clear? If we were to travel now in a time machine to the era of Bell or Edison or Einstein, I think they too would have wondered where their inventions might lead. And this is also something new. Such conversations are about ensuring that science serves good and does not cross over to the dark side. The moon, and God forbid, led to some terrible technologies that could threaten people and humanity. In
this context, I really like the idea that indeed many professionals could lose their jobs because of artificial intelligence. I really like the idea that once people hated tractors because they took away their ability to work in the fields.
Once people used to cut electric wires that were on poles and fought against it, and the telephone was perceived as something unnatural. I would also like to add, to finish this thought, that IT, even our specialists, IT technology is also worried. They also worried because many of them, those who wrote code, those who wrote software code. Now we see that artificial intelligence is taking away piece by piece these types of jobs and professions.
It's very interesting to see what will come of this, really, because it's very hard to predict. I still can't manage to do it fully. But it's very interesting, as you mentioned, that in rhinoplasty, intelligence is especially helpful.
I'll say it's not just in rhinoplasty. Right now, we're also working with scientific publications in this context because it needs to be presented in scientific writing, in scientific works about artificial intelligence. For me, as a plastic and reconstructive surgeon who works with three-dimensional space, like my doctoral dissertation, which is based on the treatment of congenital and acquired facial defects, we are developing algorithms to improve this field of activity, to bring scientific innovation. Indeed, there are significant developments. By the way, I often communicate with neurosurgeons because they also work in three-dimensional space with the brain. This is also, let's say, an indirect correlation because both fields involve working in three-dimensional space. We work with those objects that are within the reach of surgical access. And neurosurgeons, of course, they create access to the brain, but the brain is enclosed within the skull, right? In the bony space that is the skull. So what exactly are we talking about? That we can, with the help of artificial intelligence, approach surgical planning in a very intelligent way through augmented reality, using augmented reality technologies. A difficult situation arises in the presence of rather complex oncopathology, both benign and malignant, of the head and neck. The first goal is to reduce the number of surgical interventions. The second goal is to reduce accordingly the duration of the rehabilitation period. Third, to reduce the number of complications after such operations. Fourth, to be able to predict already not only how to perform such an operation in three-dimensional space, by which approach in the best way with the least blood loss and minimal trauma, but also to ensure that, from the perspective of tissue regeneration and early detection, closing it, we could achieve this with the least effort. And
risks.
And risks? Absolutely right.
Here are two questions about artificial intelligence, but I'll switch to another topic. Actually,
I'll interrupt you if I may. I'm not very fond of this term. Artificial intelligence, because de facto it's not artificial intelligence. It's not like we're dealing with some sort of, so to speak, alter ego that interacts with the human ego, with the collective social ego. Ours, for example, the collective one, like during the era of brainstorming sessions not so long ago, when people would gather, like this wonderful community that's now filming this excellent program, and we analyze the prototype of such a brainstorming session is a medical council, for example, an oncology council, when a group of oncological surgeons, oncologists, chemotherapists, pathologists, radiologists, anesthesiologists, intensive care specialists, and other experts come together to develop a treatment protocol for a patient, weighing all the risks. This is collective intelligence, a council, right? That's what they call a 5-minute meeting. Although that's not really accurate either. No one actually manages to fit everything into those 5 minutes. But the work goes on, let's say the work of human genes, which are God-given to save this particular cancer patient who has a terrible disease that for now has no answer as to how to defeat this cancer. That's why this is important. It's important to point out that artificial intelligence, essentially, you know this better than I do, that it practically unites arrays of databases, arrays of data, arrays of knowledge that are stored across vast spaces, servers, and other repositories, places where this information is kept. And there is simply a program that analyzes this enormous volume of data and provides information based on a certain algorithmic search. In other words, there is no soul there. In artificial intelligence, it's purely an engineering know-how that was created.
I can't disagree with that. And by the way, I also wanted to ask your opinion regarding the dangers and risks that the implementation of artificial intelligence might actually, that it might lead to. So do you notice that this could, since there is no longer a need, let's say, for these consultations as much as there was before, and since artificial intelligence can process a lot of information, are there risks to professionalism?
I am going to answer this particular question with a rhetorical thought, or rather, a very clear statement of fact. To put it more clearly and directly, there is now a massive and ever-growing demand in the market, and we can all see exactly how many zeros there are in the annual salary of a highly skilled specialist in artificial intelligence configuration. This is the specialist who creates prompts, that is, queries for artificial intelligence, and knows how to phrase the question so that the answer will be exactly what is needed. It will be a 100 out of 100 result. And considering that this is in the millions, I already see that certain job positions at companies like Nvidia, Apple, Facebook, and others. By the way, you can get this information with the help of artificial intelligence. It will provide it to you, or let's say through simple Google searches and so on. There are already a lot of videos available as well. And on that same YouTube, where your channel is, you can find a lot of interesting information there without any fluff. Therefore, the relevant question is there a threat? I recall a news story from the People's Republic of China about an incident where artificial intelligence, along with certain volumes of information, escaped into an independent space on the internet where this so-called artificial intelligence gained independence. And it could already pose a threat to certain parties. Internet posters.
And I believe that this actually happened
in reality. Let's find everything right now then. We'll provide the links now. I'll even help out myself if you can't find it. It's a very interesting story. I think it's not a fake because it was, it was a real news story, though not everyone heard about it. I think it was about a year ago, maybe a year or 9 months ago. And then everything went quiet. For some reason, maybe someone just hyped it up, but overall it's, if this turned into something like, let's say someone was just playing around with threats, let's call it a project, but if, as with every joke, there's a grain of truth, then we need to pay attention to make sure this doesn't become reality, like in those science fiction movies where the writers imagined such things. A director who made some very interesting films on this topic.
Absolutely. But here, it's fair to say that as long as this utopia hasn't come to us, it's actually a very good idea. We strongly encourage our dear viewers to spend at least 10 hours studying this topic, and this will truly set you apart in this world for many decades to come. I
will just briefly add that even during these surgical interventions, where either a robot-assisted system is used or the robot itself is already, its effectiveness has been demonstrated, but of course there is always a surgical team on standby just in case, God forbid, the system fails. Imagine a system that has no human assistant at all and starts doing something wrong inside a person's body. Just think about the risks to life involved. They hardly even need to be named. And here it's clear that safety is essential. I can picture such cases right before my eyes when, remember, at scientific exhibitions, they show these robots, those walking robots that suddenly start behaving very aggressively, even attacking someone. They stop filtering, start flailing their arms and legs like boxers. So there are people standing by who know how to turn it off. That's just a small comparison of the logic of how big things might look. God forbid, really, God forbid.
Just don't spray the forest with pepper spray at such a consultation. If we're talking about the elite of modern times, I'm very interested in your opinion regarding how important it is today for a modern doctor, a modern surgeon, both for their career and for their development cycles, to understand, let's say, the importance of engaging with scientific articles, writing scientific papers, and getting published. That in principle, it's not mandatory.
It's extremely important because there's this trap of reality when a person ends up in a bubble. There are such cases in surgical practice. It's the same when senior surgeons are used to working a certain way, just their own way, like that. I recently had a meeting with such a surgeon who, or rather, held the position of regional surgeon. And he, was somewhat skeptical about this younger generation of laparoscopic surgeons who grew up in America and now, by the way, also in Ukraine, who operate only using minimally invasive methods, only laparoscopic methods. And they don't even have skills in open surgery, which is risky. Why? Because if he works in a closed space, a cavity, which one? Thoracic, abdominal, working in a small area, and God forbid if bleeding starts there. A vessel ruptures or some important anatomical structure is damaged, and you need to immediately switch to open surgery and stabilize the patient, correct the situation, and achieve a good, successful outcome. So, in fact, this person, this surgeon, with all due respect, said, "No, I don't want to learn that. I won't study it because it's unnecessary. The old method is better. Why bother? Why go through all that?" And now, if you say that to laparoscopic surgeons, it's not just a country, but entire continents. There are those who work exclusively using minimally invasive, low-trauma endoscopic methods, and accordingly, in the cavities I mentioned, they perform such brilliant operations. Recently as well. We will now provide a link to this event. In China, they performed a heart transplant using a robot without opening the thoracic cavity. Just imagine that. How do you like that news, friends? Well, I think the heart itself, the transplant, is visible. We will get this article. Apparently, they inserted it through the abdominal cavity, through the diaphragm. Otherwise, I can't imagine how it was done. Or we'll check this, friends. And
In Pashitsky's Antirek, if you know the name.
well, this team, because one person can't do this alone, keep in mind it takes an entire hospital. By the way, the first such operation was performed in Saudi Arabia with Kiev, and now this is the second successful case. Such a procedure was carried out in the United States of America. We'll find both of those. Catch it.
Super. And now let's switch to a bit of Ukrainian. Can you identify the main difficulties that Ukrainian doctors face when they try to publish or even write articles? Well, the language barrier is of course a major problem. Perhaps there are others. Maybe there is insufficient policy or training in writing articles. What difficulties have you encountered?
I'll put it this way, from the perspective of two main aspects in response to this question. Our surgeons are those who possess an immense legacy inherited from the surgeons who became true stars in surgery during the war, particularly during World War II. I'm talking about Amosov, I'm talking about Shalimov, I'm talking about Avilov, I'm talking about other surgeons who were being formed at that time and who already provided lessons and established a school of surgery, a crust of bread for today's surgeons, the leaders of our specialized fields. I mean, outstanding surgeons. Boris Mikhailovich Todorov, Vasil Lazareshchinets, this is cardiac surgery, Ilya Yemets. These are the surgeons who headed such huge surgical schools. Alexander Ruzenko, the Shalimov Institute, the leader of this event. And now they held a very powerful Congress of Surgeons during the war where the entire scientific community gathered, where the best results of military surgery were presented. And why am I saying all this? I always mention and even brag about it that I was born on February 24th. Putin ruined that. It's my birthday. But I was born on the same day as Steve Jobs. Steve Jobs. And Steve Jobs, I read his biography by Isaacson. He always said to stay hungry. Well, I can say that our surgeons, you could say they're always hungry. But what are they hungry for? Hungry for a thirst for knowledge, a thirst for new technologies, new practices, the possibility that when you don't have the necessary tools, you make the impossible happen. These are like Mozart's, like Beethoven's, who perform such miracles in their field that, well, I'll say that I also try to keep up with them, of course. We go to international conferences and present these results, and when people see them, they say to me, listen, how did you manage to achieve all this when you didn't have this, that, or the other? And I will say that it would be inappropriate to boast or go on and on, but when we talk about teamwork, we are talking about the development of this entire field. A mega powerful specialty in medicine, which is surgery, it truly changes people's lives. Even on my Krasnoshapka TikTok, we say we change people's lives through surgery. That's our slogan. And what I'm getting at is that our surgeons in Ukraine perform unique operations which are quite numerous. They are unique, they are innovative, and in terms of effectiveness, in terms of technique, in terms of your work, how you do it, it's like how an artist's brush works, just as a surgeon's scalpel works. And to compare that work rather than just watching a lot of videos. If we compare the work of our surgeons abroad, we see that the Lord has granted us, through such difficult circumstances, especially now during the war, the ability to develop such talents that truly, they do the impossible. The trauma suffered by our heroes, our defenders, our guys who protect the country with their own bodies, they come to those hospitals that are in the front line zone in Kiev and in other cities. So I can say that there are a lot of surgeons from abroad who are coming here now to learn surgery because they have never seen such trauma, such combat injuries in their own countries. And God willing, may they never have to see it. That's the first thing. And second, we have now uploaded a huge amount of information on our platform, on the Valikhnovsky Academy. There are more than 200 surgical procedures there, broadcast live with English commentary, infographics, subtitles, and tags. And now this work is being watched in 70 countries around the world. We have made it available for free, so please feel free to join. We are providing free access. Right now we have a huge number of people from Ukraine and abroad have already participated. And considering that this is a bilingual product, now these achievements that we have, which we can sincerely share, over 200 live surgeries, I repeat, in fact, such webinars, seminars, and surgical sessions, we broadcast on, I believe, 4 platforms in Europe. In the United States of America, in Boston, we have partners who, after seeing this, immediately called and asked, can we come with our operators? Can we come with our team? I said, aren't you afraid of the war? No. They said, we can come. We're already ready to come for content like this, wherever you tell us. Well, that's how it is. And
can we say that despite the professionalism of Ukrainians, our contribution still insufficiently represented in the form of scientific articles, that if all this body of data that we possess, which is of interest to the world, if it were digitized in the form of scientific articles, it could have a very significant impact. Would you agree?
I would say that for our domestic researchers, as well as practitioners who want to become scientists, it is essential to combine practice with science, to truly immerse oneself in this body of knowledge, to learn this coordinate system, and to present your achievements, your results, to such a vast scientific community. I point out that this will be a tremendous success, because Ukraine is now in the headlines of all the world's news outlets. Right now, the whole world is concerned about Ukraine, about our fate. I'll say it frankly. No matter what anyone says, no matter how much they try to downplay it, the influence, the effect of being the first to provide information, that's what I mean. The year 2022, and all people whose hearts are not indifferent, including those from the scientific community, they welcome and embrace our Ukrainian scientists, our specialists with such open arms. They are 100% sincere, kind, and so supportive. All doors, all gates are open. And I have seen at so many conferences when our specialists, our surgeons come in and we present our results, people applaud, people show their support, people open all doors. And in that moment, both Ukraine and in particular our scientists have truly earned such an attitude in the world. Again, it is thanks to the sacrifice made by our defenders who protect our country, and thanks to whom we have the opportunity to record this interview now, to perform surgeries, to do our work. We may be in the rear, but we are doing what we must for our esteemed people. That's all there is to it. Everyone.
And that's it, just a little. Thank you.
To sum it up briefly, you asked a good question. I believe that we can indeed make a call to action to our esteemed specialists, the young scientific community who are now pursuing their PhDs, defending their candidate dissertations, and writing their articles. On those platforms that we have already mentioned today, there is nothing to be afraid of. You just need to take action. As they say, take the first step. The first step. A great journey begins with a single step. Learn from those teams who know how to do it. I believe this is not advertising, but scientific publications. You are leaders in this field, you also work abroad, and your company has branches overseas. And I think that you provide this product not only for Ukrainians, but you also have a lot of foreign clients who write to you with requests for help, advice, consultation, support, to tweak or polish something. This is very important.
Truly, thank you very much for presenting the information in this way, because sometimes, let's say, we get criticized like, oh, article factory and so on. However, really, there is also a lack of cooperation with us regarding assistance.
Sorry, once again, I just want to make sure we don't lose this golden thread of our conversation. Thank you for such thoughtful questions. I want to add, friends, that what we're talking about is that a consulting company which is an expert in accounting for other companies does not enter the territory. They don't replace you or me. Without us, without you, no one will write these articles. But while we are engaged in practical work constantly and have written the framework, the articles selected scientific ideas, directions for research development, sensed where scientific novelty might be, conducted the research, formed the main and control groups, compared these groups. Then, for this product to reach the level required for publication in journals like Scopus or Web of Science, that's truly a titanic effort. Such a volume of work that I think we definitely won't have the motivation to do it all on our own. And this is exactly where artificial intelligence helps, to create this sort of core content which serves as the skeleton for any research. And there is absolutely no plagiarism in this, and this needs to be stated openly. Moreover, there are programs that check for plagiarism. This is discussed very clearly in our departments by our scientific advisors and supervisors who have understood how this is done so that we comply with global standards. That's why I think this is the main point, the core idea we are talking about today.
We fully support exactly this kind of approach in our process. Thank you very much for such a family-like atmosphere.
I had a surgery that lasted about 12 hours. We were removing a giant tumor from the head. By the way, it's posted on our social media. A giant tumor that contained 2.5 liters of blood. The total blood volume in the human body is about 5 liters, depending on body mass, weight, and height. There are certain risks involved, and this entire huge volume of blood could have easily gushed out like a fountain. Well, obviously that didn't happen because we do everything correctly, so yes, if you notice such things, we start the process.
Well, that actually sounds really good to me.
In the fall, we showed this on the first channel, the first season of I'm Ashamed of My Body, a giant hemangioma of the head. I'll show it to you. This is our powerful case, so to speak. By the way, there has been no recurrence. Even now, I remember this year we filmed the first season. It was 2012. It's been 13 years since 2012. No recurrence.
And the tumor itself doesn't keep growing?
No, the tumor doesn't. It was sent to the pathology department, histology, confirmation, cavernous hemangioma, giant.
I've always wondered, 12 people in the operating room, what is that like from a surgeon's perspective? That's 12 hours of non-stop work.
Yes. They go by very quickly. There you enter a different dimension of time and everything feels completely different. Time flows differently.
A state of flow.
A state of flow, something like that. God's mercy, that's all, God's grace.
Salt.
Without God, you can't even reach the doorstep. There's a folk saying like that. What can we do?
Oh, by the way, if we didn't have this in the list of questions, but it would be very interesting, actually, regarding the question of God as such, did you come to him a long time ago or more recently? Because you haven't been a priest for that long.
6 years. My grandfather was a priest. He lived to be 96 years old, imagine that, and he was a priest for 64 years. I followed in his footsteps, guided by his prayers, and that is truly important because I also came to this as I developed my knowledge, experience, and through the steps of my life. So this is a topic for a separate interview. I think we can talk about it as well. It's very important. By the way, this is the most important thing.
Very nice. I really hope that we will highlight some of these dates. Here's one of them. Actually, off camera, I sincerely called you the most famous doctor in Ukraine. And actually, I have a question. Does such media, let's say, prominence help your career? Or are there times when it gets in your way?
I'll put it this way. For me, prominence means working your muscles. There is such a McGonigal, that's her name. Her last name is McGonigal. Willpower, a monograph. She is a professor at Stanford University. She's in her 30s. An American girl, you could say. She wrote that it can be trained. Willpower is a talent that can be trained like a muscle. But training willpower, this has been proven in research, in scientific studies. I think Kelly McGonigal. We'll check. Here's the author's name. And
Supporting woman from Harry?
Potter, well, Harry Potter is probably a bit different. But this one is real, a Stanford scientist. And she clearly stated that willpower is only trained when you get comfortable feelings from the process. When you can understand that this profession, this science is for you, you like this knowledge, you enjoy the work you do. By the way, Steve Jobs also talked about this, that you will never become successful if you don't practice what you enjoy. Yes, through difficulties, of course, but it's very important to understand this. That's why this work, which is connected with such public transparency, when you are completely open about everything, it equals 100% responsibility. Every thought, movement, word, action. And it is worth a lot. I remember the beginning of the war. With all due respect, many plastic surgeons left right on February 24th or 25th. With all due respect. Let's not judge out of habit. Everyone makes their own choice. But I believe that we were just getting started. In interviews, I say that reconstructive surgery is about treating defects, and war causes terrible defects in those who survived. And essentially, these are people who, with their sanctity, I call it that, because who is a saint? It's someone who is not like everyone else. The best of the best are those people who went and protected all of us with their own bodies. That's where the very best are. That's why I consider myself far from accomplished, because everything is always relative. Those people who truly give 100%. What we can do, we do in terms of recognition, and it's important to document what you do. Believe me, we've gone through 3 seasons. Give Me Back My Beauty, 2 seasons of I'm Ashamed of My Body. It concerns everyone, about 40 to 50 episodes. Ukraine Speaks Sukharova, about 80 episodes. I thank God that we did all of this as charity. That's the first thing. Second, we reported on each result in our social networks. Because it's one thing when you talk about it in the studio, we take you in, and that's all good. but show the result. We reported our results to our Ukrainian society. That's what's important. And I understand that in these circumstances we're in, everyone has to do their part. That's how it all started. I remember the first weeks and months of the war. I remember the addresses from our president, our prime minister, our public officials saying that we will only endure if everyone does what they were trained for, what they are strong at. And when we not only verbalize each of these strengths, but prove them through actions, not just words, then we will be able to create a real force that will not let us perish and will give us the chance to endure. No matter how many years this war lasts, no matter how long this confrontation continues. Because we hear more and more often that this is existential existence is in essence the core of our being as a people, as a nation, as human beings, as God's people who must go through these trials. So, well, dear friends, these may sound like lofty words, but they are backed by concrete, practical work. By God's grace, from the beginning of the war until today, we have constantly been in Ukraine doing everything we can to make sure everything is all right.
100%, 100%. And indeed, media exposure helps.
And first and foremost for people, because we spoke with our cardiac surgeon, a medication that is supposed to treat high blood pressure. A person takes it, but in reality their blood pressure doesn't go down, doesn't decrease. This leads to heart attacks, strokes, and in fact to fatal cases. This is a threat to life.
It concerns 100%. Such cases are very fatal. Another question regarding material matters. Perhaps it's a bit vulgar. This word sounds that way, but it is meant with the best understanding. Is it possible, because I am sure that many doctors, young doctors, have also walked this path in this sense, to follow your path? Maybe you have some advice on how a young doctor can expand their brand and present themselves to people.
You know, our youth are very talented, they learn very quickly. When we started organizing the first large gatherings, conferences, and congresses, in particular, in 2017 we held a huge surgery congress at the Mistetsky Arsenal, where there were 1,000 participants, where the ambassadors of Israel and South Korea attended the opening. We had representatives from the Ministry of Health, from the Verkhovna Rada, and all the heads of our scientific institutions were present. The Medical Institute of Rheumatology, the Kharkiv Institute of Emergency Surgery, the Institute of Endocrinology, and the Kiev Cancer Institute were all represented. All the key figures were present. It was a wonderful event, extremely powerful, and an incredibly productive scientific effort was carried out. There was a live broadcast. We're talking about the Congress, the military. We were assured that nothing like this had ever happened in history. Nothing like this had happened before or after, because we were working live on air. There was a live surgery broadcast. There were colleagues from the Royal College of Surgeons from Dusseldorf, from Turkey, Ankara, and Istanbul. There were friends from Israel, from Haifa, from Jerusalem, from Tel Aviv, from South Korea. From Korea, there was someone from their largest organ transplant center. It was such a mega cool event. And in fact, I see that this kind of work needs to be continued, to gather a bit more. In thought, you were asking me about...
Well, in general, regarding which platforms young people are really being taught on.
Right, let me finish my thought. And so I see there were about 1,000 people and 90% of it was prayer, hours. And during all these conferences, we talked about what needs to be done. We've already explained all of this. And now I see on Telegram, on Instagram, Facebook, on social networks, there are a huge number, hundreds, not just dozens, but hundreds of reconstructive surgeons, general surgeons, phlebologists, vascular surgeons, surgeons who specialize in arthroplasty, joint implantation, and those who work in neurosurgery. I have a wonderful group. Mr. Mark is a very talented neurosurgeon. He studies augmented reality, and we can show his channel now as well. They have created this mega cool setup for augmented reality in neurosurgery. And this shows just how talented the youth are, how talented these people are who come from somewhere. And this is a stage of some competition among themselves, some friction, as they say in Ukrainian. But the result is still this. Such kindness, goodness, integrity, respect, and support. And I am so glad to see this, that in our community there are such cases that make it possible to do all this. Believe me, they don't need any more advice. What we advised them back then, they've already metabolized it all, they've already crystallized it into a different form. And now they're showing some new kinds of algorithms, so I'm convinced that it's only in this kind of context that we should cooperate. The older ones should teach the younger ones, and the younger ones should teach those even younger than them. This transfer of knowledge, how was it before us, century after century?
You mentioned that there was something at Nitsky within the framework of the Congress. A surgical demonstration?
Once
Again,
I was performing a surgical procedure in the operating room, and we had to broadcast it live to the main hall. A distinguished Turkish professor came to visit my clinic. He is a specialist who traveled all the way from Ankara. He is the vice president of the IPRES Association, International Plastic Reconstructive Aesthetic Surgery Association, an association that deals with plastic surgery. His name is Nazim Serkis. Nazim Serkis is a unique surgeon. He is a rhinoplasty specialist, and he is the head of the European Rhinology Association. He was accompanied by Marcus Ariel, who is the head of IPRES in Israel. And there was also a urologist, Dr. Kaki Ashvide, who demonstrated a webinar on prostatectomy surgery using the Da Vinci robot. This broadcast took place in our clinic. Overall, we performed these surgeries for surgeons who were sitting at the President Hotel in Kyiv. There were about 50 surgeons there who were watching, commenting, and asking questions.
were they Ukrainians or not only Ukrainians?
Ukrainian surgeons. Headsets, microphones, earpieces for all members of the surgical team. The broadcast was shown on huge screens. These methods of presenting information are also a separate topic for discussion, how to show it, visualize it, even in augmented reality. You can do it through Google Glasses, through augmented reality glasses. There are such apps, by the way, which are now very widespread around the world, that allow a surgeon who owns these glasses to look through them and watch the operations taking place here. Essentially, he can walk around the operating room, move his head, and look into the wound. This is done through a 360-degree camera that is mounted on the operating lamp. And in addition, there are 2 more cameras, like the ones we're using to film this broadcast now, from different angles.
And these are the kinds of possibilities, this Google Glass, or whatever it's called, are these the opportunities for training? Yes.
This is something completely different. By the way, it has been proven, there's scientific research on this, we can provide the reference, that surgeons who play computer games, especially those involving 3-dimensional space, well, not shooters, but those that are related to spatial orientation, probably like driving a car or running obstacle courses, coordination of movements, they operate much more effectively in practical environments. It's been proven somewhere, I think, by 47 or 49% compared to those who don't engage in such activities. That's brain programming for you.
So tell me, did the actual development and growth of that specific skill really happen?
It's like gaming, it's a game. And a person practices the speed of decision making. That is a response to a changed reality. And by the way, there are such apps that teach surgeons to operate in 3-dimensional space. The only thing is, it's gamification, it's basically a person's avatar. A patient lying down, a scalpel in one hand, a scalpel in the other, a joystick in one hand, a joystick in the other, and they operate in this format. At the level of a medical student, I think this works. From the perspective of an intern or resident, there are already more advanced products that teach all of this. And when they enter a real OR, the operating department, they come in, see all these aspects and start working. I think that thanks to the development of augmented reality and the huge number of video files, it will be possible to upload such a quantity of surgeries and to create a software product that will teach a surgeon to operate in augmented reality in the format of an avatar whose tissues will be identical to human tissues. I
remember the children's Neverushka from my childhood, where there was this box like a person and so on. You take out the liver, the heart, and what really happens on a higher level.
Do you know what a laparoscopic surgeon simulator looks like? Two such laparoscopic instruments with which a laparoscopic suture is applied. Together with the younger Todorov, Mr. Mikhailo, at the clinic, we organized this for 2 years in a row, and over 1,000 of our students went through it. Those who were top students, the most erudite, the most successful in their studies. These are the medical professionals who trained on the advanced endovascular surgery simulator. On this endovascular simulator, which teaches the intricate process of how to properly place a stent, how to perform complex surgical interventions on veins, on the body's large blood vessels, the aorta, within the various heart chambers, and specifically on Klafon's specialized heart valve repair procedure. There is an entire school of cardiac surgery that studies all of this. Let's not encroach on their territory.
But in general, it's very interesting. Somehow I didn't like it from the perspective that now all of this is already so practical.
And
We literally have just a couple of catheters. That's from your experience now. To give you a specific example, I'm actually very interested in the fact that you have worked in government institutions.
yes,
It's actually if I may ask, what are the main lessons you took from there? You took them and then moved on to private practice.
I was in private practice in Minikova. Valikhnovski has already been working since 1998. And when criminals poisoned Viktor Andreevich Yushchenko, he invited me to join his team. We went through a competitive selection process. 76 surgeons and anesthesiologists participated in these selections. Roman Fedoshuk and I were chosen as the personal physicians of the president, and I couldn't refuse because I saw the terrible suffering this man endured and how he managed to survive it all. And the number of surgeries that were performed, 27 surgeries under general anesthesia, 7 facial reconstructions in particular, I personally performed. And we describe this in the Lancet journal. It's a Scalpus indexed article. It was one of the largest doses of dioxin in world history. It was administered to him with the intention of killing him. Such a dose. He survived. He survived thanks to, the circumstances turned out in such a way that it's all described there. There is this very interview. I'm simply referring to his interview. The fact that there was such severe nausea and vomiting, and given the enormous dose that was ingested during the administration of this poison during the meal. Apparently, it was cognac into which some kind of substance was added during the evening. Second, strong genetics. Third, the work of Rudolf Wienerhaus, the Austrian clinic. Fourth, the work of our clinic in Switzerland. This is a university clinic, Swiss. Professor Jean-Hilary Serra, who got involved and engaged a number of Ukrainian specialists and doctors in order to help our president survive and endure during that terrible tragedy inflicted upon him by his enemies. By God's grace, he has recovered significantly. You can look up photos on Google. Before the poisoning, during, and now, dioxin is still present in the biological tissues of the president and our patient. We have had an excellent relationship ever since we first met and up to this day. I want to take this opportunity to say a big thank you to him, since we are mentioning this now. I
really hope so.
Yes, he will watch it. I will definitely send this to him, to his assistants, and they will pass it on to him. By the way, his poisoning was described in a Netflix series. It's a documentary film called Spy Stories, and there's an episode called Poisons, where Yushchenko's poisoning is described. Find it, look it up, show it, share the link.
The link is in the occupied territory. On the one hand, it's a bit of a pity that we talked about so many things and don't have a common thread running through our conversation. But on the other hand, you are such a multifaceted and interesting person that I simply can't imagine how a conversation with you could be limited to just one topic.
Thank you for your trust, and please guide me. I want to thank you for your time and for the time of your team, for creating such a powerful product, one that our country and our people need right now. Because I have always thought about the fact that now When the state passes its laws, it treats the scientific community wisely, understanding that it is a certain core that is vital for the survival of everyone and everything. From the perspective of the economy, society, industry, theoretical sciences, and practical sciences. And these are truly the things that change the outcome, let's put it that way. I always recall the story of David and Goliath. David was a king, a prophet, the youngest among his brothers. When that Cyclops, Goliath, came out to them, all his older and stronger brothers were afraid. But David himself, who was a shepherd, tending sheep, tending lambs, gathering them, he said, "I am not afraid." He trusted in God, went forward and made a decision because of that trust, because of his faith. That was the most important thing. That was the foundation. So what does he do? He takes a sling, picks up a stone, and hits that Cyclops right between the eyes, then takes a knife and cuts off his head. This is a biblical story. This is a real fact. And in this way, he saved his people from being defeated and destroyed. They were fighting then, and the question was whether any one of them would survive. What was the point here? Faith was the most important thing, but there was also technology, and there was the victory of a smaller force over a greater one. The minority defeated the majority. And now, when we talk about our scientists who are helping with military technologies to defend our lands, we hear from everyone. This is no longer my field. These are experts. Others are speaking. Military experts, political experts don't dare to get involved there, but everyone understands, those who have even basic logic and knowledge. We understand that in this modern war, which has fallen on the shoulders and backs of our people, we have managed to stand firm thanks not only to courage and again faith, but also because technology allows the few to overcome the many. I'm talking about drone technology, about the fact that Ukraine now, in the words of our president, is the strongest, highest quality, and most innovative producer of such technologies. And there are many other technologies in our arsenal which allow us to stand our ground and defend ourselves in this unjust war. Therefore, speaking directly to every member of our local community, I would like to strongly urge that there are a wide variety of critical actions and essential resources that help preserve a human life in a moment of crisis, help provide immediate first aid, and help perform a highly specialized and unique surgical operation to create a unique prosthesis for a limb. A colossal number of our soldiers do not have limbs. They have lost them as a result of mine and explosive injuries. I had a meeting with the Minister of Health, Lyashko, some time ago. He is a unique person, a very powerful manager in his position. The things he is doing are truly unique. Just imagine, he was at the helm of the ministry during COVID and is still performing at his level. He does powerful work, both as a manager, a strong state leader of his department, and as a person, an honest and decent individual. That's why I want to say that thanks to such communications, there was a conversation that there are already some issues. Thanks to technology, the Unbroken Foundation in Lviv region and other foundations that help with prosthetics for lower limbs. But the issue that needs to be addressed is head and neck. That's exactly what we specialize in. This is our contribution, a small ribbon that we add to our common cause, victory and perseverance. So everyone who can joins in and does what they can. And if we don't know something, we learn, just as in the words of our classic Taras Rehorovich.
Like and subscribe.
Goldik, bye.
Subscribe to our channel. Follow us on social media. Rostyslav Lyubomirovic. We will leave the link in the description under this video.